science communication, how to battle misinformation and disinformation, and harness the power of storytelling can help physicians, residents, fellows, and others help connect with patients in the community and impact public health. And today we are here with the Graduate Medical Education Community Champions Program. We are thrilled to be offering a special workshop on how to combat misinformation and use the science of storytelling with the Dean for Medical Education at University of Chicago's Pritzker School of Medicine in partnership with the Institute for Translational Medicine, all thanks to a grant from the Association of American Medical Colleges.
8 out of 10 people in the general public believe one common falsehood about the coronavirus vaccine.
You know, there's a lot of misinformation that gets easily spread through the media. It's important for us as healthcare providers to be a resource for our patients, to provide credible information, but also how to communicate that effectively.
Know who you're talking to. That's going to shape the analogies that you use. That's going to shape even how you start that interaction. When Beyonce gets on stage, does Beyonce walk slowly and shuffle on stage with a hunched back and not make eye contact with her fans? You mentioned Beyonce. Let's do it. Come on. Come on. Yes! Yes! What did you notice about that body language? Specifically, let's get concrete. Shoulders back. That matters. People will have trust in your confidence.
We laid out a myth that exists in our specialty or in our practice.
The myth is sticky and it's so hard to debunk.
And then the fact.
The fact is that the risk of getting HIV or other infections from a blood transfusion are infinitesimally low. But the myth that I've encountered in patients who are very hesitant to take a blood transfusion is that they will be at risk because the processes have changed drastically. Almost always the benefit outweighs the risk.
Yeah, I love leading with the fact and the story of why the things have changed. So yes, snaps for Bernice.
The practical portion was the most interesting and fun thing for me.
When you use jargon, science shows that not only do people's eyes glaze over, they don't really understand what's going on, it actually makes the public trust in science less.
It gave us some actionable items for ways to effectively translate scientific information to the public and can inform patients need to make about their own care.
You know, the state of our country's health is in the balance of this type of material.
So the U.S. Surgeon General has declared misinformation a public health crisis. It's on par with the opioid epidemic.
Now more than ever, we need physicians who are also activists in our communities, who are fighting for the changes in policies that we need to increase the overall health of our society. You know, my personal passion is to be a surgeon activist, using what I see on a daily basis in the operating room as well as in the trauma bay with our trauma patients, and using that information and those experiences to fuel my drive for making change in my own community. The information that we learned today was especially relevant to what I want to do with my career and raising awareness as well as creating an impact in terms of gun violence in our community. Thank you. Thank you for this. This is critical, especially in the age of social media. This is actually more critical than I think most people understand.
Champions, let's go.